Case study analysis. An overview of the case study, an adaptation of the Coping Cat program, the successful treatment of a 6-year-old boy with generalized anxiety disorder. Original case by Kurt D. Michael, Lucinda O. Payne, and Abby E. Albright. Video presentation by Lauren Francavilla. Case description. Subject: 6-year-old non-Hispanic Caucasian male, elementary school student. Relevant background information. Younger of 2 children, lives with brother and married parents. Family history positive for anxiety disorders in at least 4 maternal generations. Medical history unremarkable aside from controlled asthma. Normal development. Birth and delivery along with family dynamic considered to be normal. Abnormal development. Genetic mental health history, familial, and expedited developmental milestones considered to be abnormal. Relevant diversity characteristics. Males are generally less likely to develop anxiety disorders. Race is of no particular importance. Ethnicity holds no notable significance. Religion and socioeconomic status are non-applicable to development of disorder. Diagnosis. Patient's diagnosis is generalized anxiety disorder. Description: a highly prevalent psychiatric disorder associated with cognitive distortions and impaired daily functioning. DSM diagnostic criteria: pervasive anxiety and concern present consistently for a minimum of 6 months and across various aspects of the subject's life. Issues regulating anxiety: must present with at least one of the following: quick to fatigue, irritability, sleeping issues, tense muscles, feeling on edge. Support: subject often wakes from sleep at night to perseverate over trivial interactions from the previous day and is constantly contemplating possible, although unlikely, negative scenarios. Assessment, treatment, and other findings. Assessment tools used. Tools used included a semi-structured clinical interview adapted from the structured interview for the DSM, Kitty schedule for affective disorders and schizophrenia in school-aged children, the Parent Report Scale of the Behavioral Assessment System for Children, or BASC, BASC2, and SUDS. Treatment approaches. Treatment plan made use of the Coping Cat program for anxious youth to help manage and reduce anxiety along with 10 cognitive behavioral therapy or CBT sessions over a 4-month period, each lasting between 60 to 75 minutes, often involving the patient's parents. Treatment outcomes. Patient experienced a substantial reduction in GAD symptoms. Post-treatment anxiety, depression, withdrawal, and atypical BASC scores were substantially improved and were all within normal range. Other relevant findings. I believe that using primarily CBT treatment instead of immediately attempting to medicate the child was a wise decision on the part of the psychiatrist and parents. Personal insights. I find this case to be a perfect example of how not all psychiatric and psychological conditions are immediately treated by medicating the patient. Most people tend to assume that medication is the first or only choice when it comes to treatment for disorders of the mind and emotions, and this is simply not true.